Hello guys, good evening. Welcome back to my channel. So today I am going to talk about 5 moments of hand hygiene. So before talking about that topics, let's know what is hand hygiene and why it is most important. So hand hygiene is most important to prevent cross infection. So cross infection means prevent infection from each other. That is from patient side to our side or from our side to patient side, because uh, cross infection may develop from each other by getting infection. So without washing hands, without maintaining proper hand hygiene, if directly touch the patient, that means patient may get infection from our side, or after touching the patient, if you don't wash our hand properly, that means we can get any kind of infection from patient side to our side. So because of that, always we have to remember that 5 moments of hand hygiene when we have to maintain hygiene of our hand. As we know, always we have to maintain our hand hygiene from preventing of infection, but especially there are 5 moments. That is, number one point is that is before touching a patient. Why it is important before touching a patient? Because infection may transfer from our side to patient side. So because of that only we have to wash our hand before touching the patient. Okay, the next point is before cleaning or doing any kind of aseptic procedure. That means before cleaning or maybe before doing any kind of aseptic dressing. Aseptic means which we cannot give any kind of infection by following all the sterile technique. So that is before doing suppose we are going to do a dressing of the patients by following sterile technique, by wearing gloves or whatever. Okay, but if we don't wash our hand, by mistakenly we may think that okay, I am going to wear gloves, so I should not wash my hand. No, it is not like that. So always we have to remember the moments of hand hygiene. As number one is before touching, so before doing any kind of dressing also, always we have to wash our hand. And next, number 3 point is after touching or handling any kind of body fluid of the patient. After touching a patient, always we have to wash our hand. That is because we don't want to get any kind of infection from patient side to our side. And next, that is at the same time, after touching of any kind of body fluid means maybe ascites fluid or maybe pleural fluid or whatever the infectious things coming out from patient side, we used to touch, we used to give care, but always after doing that kind of things, always we have to wash our hand. And number 4 point, that is after touching a patient. So as we know, before touching also we have to wash our hand. And number 4 point, that is after touching a patient. After and before, always we have to wash our hand after touching the patient or before touching the patient. And number 5 point, that is last point, that is after touching patient surrounding. That means after touching patient surrounding means maybe patient's bed, maybe patient's bedside table, maybe patient's equipment, maybe patient's utensil, whatever patient used to use. After touching, always we should not forget to wash our hand, because infection from which side it may come to our body or from which side it will go to patient side, we may not know, but we always watch our hand. That is by following and these 5 moments, always we have to remember to prevent cross infection. So this is my topic for today. Next topic, I'll bring in new topics next class. So hope you all understand, and please like my channel, share my channel, and subscribe and give comments. Thank you for today.